So good evening, everyone. I, Rachit Kumar from Sun Pharma, welcome you all and thank you for joining with us on very special series, Hear Your Heart, Suno Dil Ki on this Speak Health platform. Most of us are aware that heart disease is the leading cause of mortality or death, and its prevalence is increasing rapidly in India. Unhealthy lifestyle, mental stress, unawareness about the risk factors, consequences, and lot of myth around heart disease are the major contributor for the increased prevalence. Active lifestyle, positive attitude, and expert guidance can help population at large to avoid heart disease or its consequences. With this objective and World Heart Day tomorrow, Speak Health has initiated a series of live sessions with the experts in the field of cardiology who will share their thoughts on managing heart disease. For today's session, the topic is heart disease, all you need to know, and to deliberate further. Actually, this was a panel discussion, but due to some unavoidable circumstances, Dr. Sunil Shivale is not available. So we have with us Dr. Alok Shinde. So Dr. Alok Shinde is consultant and intervention cardiologist at Dr. Shinde Heart Care Center, Kolhapur. So I welcome Dr. Alok and would like to ask first question to Dr. Alok. Welcome, sir.
Thank you.
Yeah. So, sir, my first question to you is, what is basically a very common question? What is heart disease?
Basically, for non-medical person or lay people, heart disease is equal to coronary artery disease because they consider that there is only one type of heart disease, which is coronary artery disease. But I would say that there are 6 types of heart disease, and coronary artery disease is one of them. Coronary artery disease is blockages in blood vessels or arteries supplying blood to heart. Okay, so that is coronary artery disease, or the disease of coronary artery disease occurring due to blockages in coronary arteries which supply blood to the heart. Then there are some other structures in heart as well, which are valves. Blockages or stenosis or narrowing or leakages in valve leads to is called as valvular heart disease. So that is treated with either valvotomies, balloon valvotomies, or valve replacements. So that is second type of heart disease. Third type of disease is cardiomyopathy, or disease of cardiac muscle or heart muscle. When muscle of the heart becomes weak, that is called as cardiomyopathy. Sometimes it becomes stiff, that is restrictive cardiomyopathy. When it becomes weak, that is dilated cardiomyopathy. And when it becomes thick, then that is called as hypertrophic cardiomyopathy. So that is third type of heart disease. Then fourth type of heart disease is disease of the pericardium, which is a covering of which is a covering or a membrane covering the heart. So they are called as pericardial diseases. Sometimes blood or water gets accumulated in them and causes pericardial effusion, and then that membrane becomes calcified, and then that is termed as constrictive pericarditis. So such as these are pericardial diseases. And fifth type of diseases are diseases of cardiac conduction system, or in other language I would call it the diseases of wiring of heart. So we all know that cardiac heart is a structure which beats constantly, but for the heart to beat, we need some electrical impulse. So there is a conduction system involved, and which controls everything. So diseases of conduction system lead to either decrease in heart rate or increase in heart rate above or below the normal range. So they are conduction system diseases, which are treated by pacemaker implantation or electrophysiological studies or radiofrequency ablation. And then there are sixth type of heart disease, which are congenital heart diseases. People are born with those diseases. They can be in the form of holes in the heart, or stenosis in the valves, or various other abnormalities of cardiac structure or function.
Right. Thank you, sir, for the elaborative discussion on the heart disease, the types of heart disease. So I think audience must be clear by now that what are the 6 kinds of heart diseases. So, sir, now we know about the heart disease. So, what are the early signs and symptoms of heart disease?
Basically, there are only main 4 symptoms of heart disease, and those symptoms are these symptoms are seen in all of these heart diseases. 6 types of heart diseases. Most common symptom is shortness of breath or breathlessness or breathing difficulty, also called as dyspnea in medical language. The second most common symptom is chest pain, or also called as angina. And then third symptom is palpitations or uncomfortable awareness of one's own heartbeat. And then fourth symptom is syncope or giddiness. It is more commonly seen in structural heart diseases, or when your valve becomes narrowed and the cardiac output is not enough for the heart, or it is also seen in electrophysiological diseases or diseases of conduction system, when the heartbeat goes below 40 and or the heartbeat goes above 180 or above 200. That times the cardiac output is not enough for the brain, and it results in fainting or syncope or loss of consciousness. So
Right.
breathlessness, chest pain, palpitations, and giddiness or syncope. These are main predominant symptoms of heart disease.
Right. So very rightly said, chest pain, breathlessness, syncope, or giddiness are the symptoms of the heart disease. So with this, sir, as we know now the early signs and symptoms of heart disease, so can we know about the risk factors for heart disease? What are the risk factors associated for heart disease?
Very good question. So when we say risk factors for heart disease, we need to cover each and every type of heart disease. First, coming to the most common type of heart disease, which is coronary artery disease. The risk factors for coronary artery disease are use of tobacco and tobacco products, that is smoking and or tobacco chewing, and use of tobacco in any form for that matter. Then second is diabetes mellitus, and third is hypertension, fourth is obesity, fifth is physical inactivity, and sixth is family history of premature coronary artery disease. So these factors are responsible for coronary artery disease. Then second, coming to the second most important cause of valvular heart disease is in India is rheumatic heart disease due to improper hygiene or occurrence of streptococcal throat infection in childhood. Such people develop carditis, and they go on to develop stenotic or regurgitant valvular lesions in their future life. Then another important reason is aging. Old people develop there is deposition of calcium then in their aortic valves or mitral valves, and leading to aortic stenosis. And such people need valvular replacement. Then again, coming to third type of heart disease, which is cardiomyopathy or weakness of heart muscle. There are various causes, which most one of the common causes is alcohol addiction. Excessive alcohol consumption can cause toxic cardiomyopathy or alcoholic cardiomyopathy. Then after delivery or around the time of delivery, it is also seen in females. So multiple pregnancies, and at the time of delivery, they develop weakness of their heart muscles. It is called as peripartum cardiomyopathy. Then there are various causes such as viral infections. In fact, during this COVID pandemic, there are a lot of patients who developed COVID-related myocarditis and heart failure. So COVID is one of the very important cause of weakness of heart muscle leading to heart failure. Then conduction system diseases, there are various causes such as viral infections, and then some are idiopathic. I mean, sometimes it's just there is no etiology. And coronary artery disease can also cause LV, left ventricular dysfunction, leading to ischemic cardiomyopathy and conduction system disease as well, needing pacemaker or ICD implantations. And congenital heart diseases they occur more commonly in mothers who are diabetic. Then consanguineous marriages, when the marriages happens in blood relations or close relatives, so they are important causes.
Right. So you talked about cardiac myopathy. What is that? I mean, for the benefit of the audience.
Cardiomyopathy means weakness of heart muscle. It causes decrease in pumping capacity of the blood, leading to failure of heart to function properly. And it is your heart just fails to function, and then it causes shortness of breath, and person is not able to perform activities of daily living. And that's why, I mean, it is a important thing which decreases your quality of life. So one must identify whenever they complain of shortness of breath, they should consult their treating physicians or cardiologists whenever they feel that it is not usual or it is an unusual symptom. So you need to get yourself evaluated. And sometimes shortness of breath could be a symptom of coronary artery disease also, despite a normal pumping capacity of the heart.
Right. So very rightly described the risk factors and the different types of heart diseases. So my next question is, now we understood about the risk factors and what are the various kinds of heart diseases. So what happens if heart disease is left untreated?
When heart disease is left untreated, it will cause irreversible damage to your heart muscle, leading to heart failure. Again, that is irreversible. That damage is permanent and it cannot be reversed. Again, it can cause sudden cardiac death also, repeated hospitalization for chest pain or breathlessness, causing heart failure, and it decreases quality of life. Then again, the worst is sudden cardiac death. It can cause sudden cardiac death, and then sometimes sudden cardiac arrest can be a presentation of many cardiac illnesses. So the premonitory symptoms or slight hints that your body is giving you must not be ignored.
So very important advice by Dr. Alok Shinde to the audience over here. If you have any of the signs and symptoms, usually the breathlessness, so you should not ignore and consult your healthcare professional as soon as possible. So sir, with this coming to the measures which we should follow to reduce heart disease. So what are the measures, the precautions we should take on daily basis with prevent the heart disease?
Definitely, very and most important part of today's discussion and question and answer session. I would like to address this point by point. I mean, first most important point is, and factor responsible is use of tobacco and tobacco products. People who are addicted to use of tobacco must quit smoking or stop tobacco chewing, because along with deadly cancers, tobacco causes heart disease and stroke also. So quit smoking, stop tobacco chewing. Then second is diabetic people, those who are already or those who already have diabetes must try to keep regular follow-up and maintain your sugars below your glycosylated hemoglobin below 7 to prevent complications of diabetes. And heart disease is one of the most important complications of diabetes mellitus. And then for hypertensive people, they should try to keep their blood pressure below 140/90, and they should practice salt restricted diet, and then dietary and lifestyle modification. And physical inactivity is important, because less than 30 minutes of moderate intensity physical activity leads to obesity and diabetes, and leads to increased waist to hip ratio and BMI more than 24. So try to engage in at least 30 to 45 minutes of physical brisk walking for minimum 5 days in a week. So try to keep your waist to hip ratio below 0.8 for women and below 0.95 for men. And try to keep your body mass index below 24. So that will prevent visceral obesity, which is a risk factor for coronary artery disease, and so on. So you should moderate your alcohol consumption or stop it altogether, because that will prevent alcoholic cardiomyopathy and various arrhythmias. And one should not have marriages in blood relations or close relations. Consanguineous marriages should be avoided. Then those who have tuberculosis should be monitored for involvement of heart and heart structures, because TB can also affect the heart. And infections or any long-standing fever should not be ignored, because it could be a sign of infection of heart valves, and proper hygiene should be practiced. So regular follow-up with your cardiologist and physician is of paramount importance.
True, sir, very true. So important takeaway from the last question is 30 minutes, 30 to 35 minutes of brisk walking per day for minimum 5 days in a week is very much important to prevent the heart disease, to prevent the obesity, which can lead to heart disease. With this, sir, there are few questions from the audience side, which I would like to take it up. So first question is, can stress cause heart disease?
Definitely. Most important question, because stress and lack of sleep lead to increased sympathetic activity, which leads to increased increased level of stress hormones in your blood, that causes wear and tear of your bodily structures, and also leads to heart disease. So excessive stress definitely causes heart attack. Lack of sleep also is a very important reason. So you should have proper 7 to 8 hours sleep per day. That is also important to prevent heart disease.
Right. And sir, just one question is there. What medical test should a healthy individual undergo and at what frequency, so that he can come to know whether he's suffering from any kind of heart disease or not?
I think we will stick to basic tests such as electrocardiogram, ECG, or lipid profile testing. And timely and people who are above 35 or 40 years of age, they should at least look for the development of hypertension or diabetes. You should consult your physician at least once a year.
Right. So once a year they should consult. Right. Sir, many a times it happens, people are now using blood glucose monitoring devices and blood pressure monitoring devices at home. And when they see that their readings are coming to normal in 7 days or 8 days or 10 days or maybe in a month, they tend to stop the medication without consulting their healthcare professional. So how dangerous it is and what can it lead to?
Basically, they are not doing it according to proper guidelines, because they need to know whether they are diabetics or pre-diabetics, because there is a stage where diabetes can be reversed. So at the stage of pre-diabetes or impaired glucose tolerance, you may be able to reduce your blood sugars or blood pressure just by dietary and lifestyle modification. But every patient is not the case for that. So there is a stage in which every illness where the illness can be controlled or reversed by dietary and lifestyle modifications alone, but every patient may not qualify for that treatment. So you need to do it under proper.
Right. So, sir, next question is, what is the basic difference between heart failure, attack, and cardiac arrest?
Basically, heart failure is failure of or decrease in pumping capacity of the heart, leading to water accumulation in your lungs and body, causing swelling over lower limbs, distension of abdomen, and breathlessness in lying down position. So that is they are basically symptoms of heart failure. And cardiac arrest can occur due to any disease. Any of the disease can cause cardiac arrest. Such as the patients with heart failure can also cause sudden cessation of function of heart, like your heart stops functioning for some time. So that is cardiac arrest. And cardiac arrest could be a presentation of heart failure and any other diseases like coronary artery disease. Heart attack can lead to heart failure, and heart attack can cause cardiac arrest also.
Very true. So this was possibly the last question from the audience. So, sir, before leaving, final takeaways from your side for the audience on the World Heart Day tomorrow.
Yeah. So awareness is important, because without our awareness, there cannot be change. First comes awareness, then comes acceptance, and then comes the change. So be aware, accept your risk, and then only you will be able to bring about the change. Stay active, stay healthy.
Right. So very rightly said, bring awareness, accept it, and then change yourself. Stay active, stay healthy. With this, I would like to propose the vote of thanks. So on behalf of Speak Health and Sun Pharma, I would like to thank Dr. Alok Shinde for excellent discussion on heart disease, all that you need to know. I'm sure audience must have benefited from the session here to Heart Series Suno Dil Ki. Last but not least, thanks to audience for making this session interactive by asking the relevant questions. Just like to inform that this video would be archived on Facebook's Speak Health page, which have close to 8 lakh followers. Your contribution will definitely help protect one heart to protect many. Hoping to associate with you in future as well. Thank you and good evening. Thank you, Dr. Alok Shinde.
Thank you for giving me the opportunity to speak on this forum.
Our pleasure, sir. Thank you.